Let's discuss face reading, low back pain, lower back pain. Those who have moles in the eyebrows are prone to lower back pain. The bulge and deformity in the lumbosacral vertebral zone of the ears turning to nodules is a warning sign of lumbar degeneration. So here is the illustration of a mole in the eyebrow and nodules in the ear. Therapeutic methods. Make sure that you get plenty of rest during an onset of lower back pain, and some massage can be done to relieve the pain. Proper care in daily life can prevent the onset and alleviate the pain. Dietary advice. Maintain a light diet with plenty of vegetables, fruits, and beans. Consume foods that tone the lower back and kidney, promote blood circulation, and dredge collaterals such as walnuts or Chinese wolfberries. Exercise. Don't sit still for too long. Instead, change your posture from time to time. Do some low intensity exercises such as walking or yoga. Lifestyle. Avoid staying a humid environment. Keep your lower back warm and avoid catching colds. Avoid carrying heavy weights to protect the lower back from strain. Yaoyang 1.23. Moxibustion. Perform moxibustion on the waist hong point to relax tendons and alleviate pain. The Shenshu and Dang Changshu points to invigorate the kidney and replenish essence to enhance qi and blood, and the Yao Yang 1 point to relax tendons and soothe meridians, alleviating or eliminating pain. Gentle moxibustion at each of these acupoints for 15 minutes once daily can relieve lower back pain. Massage. Massage the waist hong point on the pathway of the Taiyang bladder meridian of the foot. It has the effect of relaxing the tendons and dredging collaterals, dispersing blood stasis and promoting blood circulation, clearing heat and eliminating toxins. Press the Wei Hong point with the tip of your thumb until a distension is felt. Then press and release. This is considered one manipulation. Do this 1 to 20 times in a row. Massage once daily. Keep on massaging and your lower back pain will be relieved. Thank you for your attention.
Interviewing. Premature ejaculation. Uncontrolled ejaculation and low sperm count. Premature ejaculation or uncontrolled ejaculation can arise when there is either not enough qi and yang to hold the semen back or too much yang in the form of heat, which drives the semen outwards. Too much yang can be an excess or a deficient condition. Traditionally, sperm quality was not something that could be quantitatively measured. The only thing that could be observed was the consistency, color, and quantity of semen. By combining modern analytical techniques and traditional knowledge, it is now possible to differentiate the relevant imbalance patterns when diagnosing poor sperm quality. Kidney yang deficiency and in some cases blood stagnation can manifest with a low sperm count, sperm that are malformed or sperm that have a short lifespan. Kidney yang deficiency can manifest with poor sperm motility. Thin and watery seminal fluid can also be a sign of kidney yang deficiency. Seminal fluid that is thick and sticky is more typical of dampness, especially damp heat. Damp heat can also make seminal fluid yellowish or too acidic. Premature ejaculation is usually related to a kidney pattern and especially kidney qi not firm. It also may be due to a heart pattern such as heart qi or heart blood deficiency. If kidney qi is not firm, then premature ejaculation, dribbling of urine that is worse after sex. There may also be clear frequent urination, weak stream urination, incontinence of urine, soreness and weakness of the lower back. There may be weak knees, tiredness, dragging down feeling in the lower abdomen, feeling cold limbs, pale tongue, and a deep, weak pulse. The acupuncture points would be bladder 23, Ren 4, and Du 4. If there is a spleen and heart yang deficiency, there may be premature ejaculation, poor appetite, slight abdominal distension after eating, tiredness, lassitude, pale complexion, weakness of the limbs, loose stools, feeling cold limbs, edema, palpitation, shortness of breath on exertion, spontaneous sweating, a slight feeling of discomfort or stuffiness in the heart region, pale and wet tongue, and a deep, weak pulse. Acupuncture points would be Ren 12, stomach 36, spleen 6, bladder 20, heart 5, bladder 15, Ren 15, and Moxa. If there's damp heat in the liver channel, there may be premature ejaculation, burning or urination, urinary difficulty, dark urine, genital, papular or vesicular skin rashes and itching, fullness of the hypochondrium, abdomen or hypogastrium. There may be bitter taste, nausea, feeling of heaviness of the body, red tongue with redder sides and sticky yellow coating, and pulse would be slippery, wiry, and rapid. Acupuncture points, liver 2, Ren 12, Ren 9, spleen 9, Li 11, Ren 5, Ren 3. For a clinical note, heart chi descending plays a role in ejaculation. Therefore, premature ejaculation may be due to heart chi deficiency. For this reason, I treat the heart and the kidneys. Thank you for your attention.
Let's now talk about Xiaolian, or lower angle, as we continue with Han Yangming, large intestine meridian. Li8 or Xiaolian is located on the posterior lateral aspect of the forearm, 4 tune inferior to Li11 and 3 tune superior to Li7. Li8 tonifies the large intestine meridian. It frees the channel and is used locally for pain. It is also used for pain and distension in the intestines, large and small. It clears fire from the stomach and large intestine, and so is used for similar reasons as Li7, that is for mania. The name refers to the anatomical location. Both Li8 and Li9 are along the inner ridge of the radius, and Li8 is the lower of these 2 points. It is for pain in the elbow or arm, for madness and hysteria, and for intestinal pain. Li8 and Li9 are a reflection of the upper limb of the points stomach 39 and stomach 37, the Hussey point of the small and large intestine respectively of the lower limb. Xiaolian or Li8 is therefore indicated for disorders of the intestines, particularly the small intestine manifesting as fullness. It's for distension and pain of the abdomen, periumbilical pain, insufficiency of small intestines, chi, blood in the stool, and diarrhea containing undigested food. In clinical practice, however, the points on the lower limb are much more frequently used to treat intestinal disorders. The large intestine divergent channel descends to the breast, and Xiaolian or Li8 is indicated for breast abscess, the only point on the large intestine channel with this indication. The action of Xiaolian or Li8 on clearing Yang fire and calming the spirit, and thus treating manic raving and mad walking, is similar to that of Li5. Thank you for your attention.
Let's discuss differential diagnosis, Western and Chinese medicine, tiredness. Due to narcolepsy, There is tiredness with persistent drowsiness, difficulty staying awake during class or work, sudden uncontrollable need to sleep during the day. Number two, due to sleep apnea. Tiredness associated with abnormal daytime sleepiness, loud snoring, awakening not rested in the morning, poor concentration, memory loss. Number three, due to diabetes type 1, tiredness, excessive thirst, frequent urination, hunger, weight loss, fatigue, nausea, and vomiting. Type 2, tiredness in excessive thirst, frequent urination, hunger, fatigue, blurred vision, slow healing, infections, impotence in men. Number 4, due to food allergies, tiredness with abnormal pain, nausea and vomiting, diarrhea, scratchy throat, itching, nasal congestion, wheezing, difficulty swallowing, anaphylaxis if severe. Number 5, due to chronic fatigue syndrome, chronic tiredness, mild fever, sore throat, lymph node tenderness in the neck or armpit, muscle aches, joint pain. Number 6, due to hypothyroidism, tiredness with weakness, cold intolerance, weight gain, constipation, depression, joint or muscle pain. Number 7, other causes include trauma or injury, depression, chronic anxiety, excess alcohol, drugs like antihistamine, narcotics, analgesics, beta blockers. Chinese differentiation, tiredness, diagnostic questioning according to number 1, type of tiredness, better for exercise is an excess pattern, worse for exertion is a deficient pattern. Following trauma and shock is a blood stasis. With desire to lie down is a spleen-yang deficiency. With listlessness, kidney-yang deficiency. After eating, feeling of heaviness, that is dampness. After eating and in the mornings with mossy head, that is phlegm. Short term with alternating hot and cold, xiaoyang. Number 2, tongue diagnosis, thick coat, that is damp or phlegm, swollen, pale, thin coat, spleen-chi deficiency. Swollen, pale, bluish moist coat is a spleen and or kidney-yang deficiency. Unilateral coat, xiaoyang, dry red, yin deficiency. Number 3, etiology, weak constitution, excessive mental or physical work, prolonged exposure to external cold, damp, weak phlegm, kidney function, irregular eating, overeating, poor diet, excessive lifting, severe illness, fear, anxiety, shock, childbirth, phlegm dump. Number 4, Sangpo pattern for excess, stagnation of liver qi, retention of dampness, phlegm, invasion of wind at xiaoyang stage. Deficiency, lung qi or yin deficiency, spleen yang deficiency with damp obstruction, spleen qi deficiency with phlegm obstruction, middle burner, heart and spleen qi deficiency, kidney yang deficiency, liver blood deficiency, kidney yin deficiency. Thank you for your attention.
Let us now go to epigastric pain. The topic is stomach phlegm-fire. The clinical manifestations of stomach phlegm-fire is any of the symptoms and signs that can occur in stomach fire. In addition, there may be the following clinical manifestations, such as a feeling of oppression of the epigastrium, dry mouth but no desire to drink, mucus in the stools, nausea, vomiting, mental restlessness, and in severe cases, there will be manic behavior or manic depression and insomnia. The tongue will be red with a very sticky or slippery yellow coating. The tongue may have a wide stomach-type crack in the center with a rough, brush-like, dry yellow coating inside it. The pulse will be slippery, rapid, and overflowing. All of the aforementioned symptoms and signs are due to phlegm. A feeling of oppression in the chest is typical of phlegm. The mouth feels dry because of the fire, but there is no desire to drink because of the phlegm. As the stomach is functionally related to the large intestine, there may be mucus in the stools. Nausea or vomiting are due to phlegm impairing the descending of stomach qi. The tongue crack illustrated in the previous slide is typical of stomach phlegm-fire, and it almost invariably indicates that the mind is affected by phlegm-fire and resulting in severe cases of manic depression. The treatment principle is to harmonize the stomach, clear the fire, resolve phlegm, and calm the mind. The points to be used are stomach 21, REN 12, REN 13, pericardium 5, stomach 40, pericardium 7, DO 24, gallbladder 13, and stomach 44, using the reducing method in each point except for REN 12, which should be reinforced. The explanation for the points used is that stomach 21 is used for stomach excess patterns. REN 12 tonifies stomach and spleen to resolve phlegm. REN 13 subdues rebellious stomach chi and is used if there is nausea or vomiting. Pericardium 5 resolves phlegm from the stomach and the mind. Stomach 40 resolves the phlegm. Pericardium 7 resolves phlegm and calms the mind. DO 24 and gallbladder 13 calm the mind, and stomach 44 clears stomach heat. As dietary advice, the patient should avoid eating too many fried food and also avoid hot energy food as described for stomach heat. Thank you so much for your attention.
Let's now proceed to diagnosis according to Zhang organ patterns, the third part of pathology of liver imbalances. Heat conditions in the liver can also manifest with redness of the eyes. This is because the eyes are the liver's sense organ, and the gallbladder channel starts its course in the corner of the eyes, and liver excess conditions tend to manifest themselves in the gallbladder channel. The eyes are nourished and moistened by the liver blood and liver yin. If there is liver blood deficiency, the lack of nourishment of the eyes can cause the person to have trouble focusing, or there may be floaters or spots in the field of vision. If there is liver yin deficiency, the eyes can be dry and feel gritty because they are not moistened by liver yin. Ascending liver yang or liver fire can increase the pressure inside the eye, and this will cause pain inside or behind the eyes. When there is liver chi stagnation, the body will often try to disperse the stagnation by yawning or sighing. When the body inhales a large amount of air, as you do when you yawn or sigh, it will increase the strength of the zong chi. This will help to increase the force behind the chi in the channels and the vessels, and thereby spread the stagnant chi. When liver chi stagnates, it can lead to accumulation of phlegm in the throat. This will give the characteristic sensation of having a lump in the throat that cannot be swallowed. This sensation may not be constant, but will typically be influenced by the person's emotions. The Chinese describe this sensation as feeling as if there is a plumstone stuck in the throat and call it the plumstone chi. Headaches and dizziness can arise when there is too much chi ascending to the head, which is typical in liver excess conditions, or when there is too little blood ascending to the head, which is a consequence of liver blood deficiency. The liver channel passes around the genitals. If the liver is invaded by exogenous cold, or if there is a stagnation of chi in the liver channel, the person can have pain or tension in or around the genitals. That is also why the liver chi stagnation can result in impotence in men. Damp heat in the liver can also mean that there may be red, weeping sores on or around the genitals. Damp heat in the liver can manifest with red and suppurating ulcers elsewhere along the liver channel. Liver blood nourishes the tendons. This means that the tendons, sinews, and joints in general can become stiff when there is liver blood deficiency. The nails are a type of tendon in Chinese medicine anatomy. A classic sign of liver blood deficiency is fingernails that are soft or brittle or break easily. The fingernails are often ridged and can be very dry when there is liver blood deficiency. The lack of nutrition from liver blood may mean that the muscles in general lack strength and suppleness, whereas liver stagnation will manifest with muscles that are stiff and tense. When there is liver blood deficiency, there can also be a tingling sensation or numbness in the arms and legs. This is because the muscles and tendons lack nourishment. Blood returns to the liver and leaves the muscles when they are inactive at night. This means that some people who are liver blood deficient or yin deficient experience unrest and cramping in their legs in the evening and at night. When the liver generates internal wind, it will make the muscles extremely stiff and rigid, or they will spasm and cramp. This can be seen when there are fever cramps in small children or a rigid neck muscle in meningitis, but it could also just be tics in the facial muscles. Heat in the liver, like heat elsewhere in the body, can injure fluids and desiccate the body. When there is liver stagnation heat or liver fire, there can be tangible signs that the fluids are being consumed by heat, such as thirst, dark urine, and dry stools. Furthermore, there will often be a bitter taste in the mouth when there is liver fire. General symptoms and signs of liver imbalances. There will be menstrual disorders, mood swings, irritability, bloating or tension, hypochondriac tension, and thank you for your attention.
Inspection. Tongue coating color. When examining the tongue coating, carefully note the changes in its color and texture. The coating color. There are four colors are commonly seen clinically: white, yellow, gray, and black. Clinical correlates of tongue coating colors. So if the tongue has a white coating and the color and texture is thin and white, the illness is in the exterior or of cold. Its clinical significance would be normal or early illness in the exterior. If the coating is thick and white, slick or greasy, then clinical significance would be phlegm or dampness or cold dampness accumulation and indigestion. If it is thick, white, and dry, then there might be phlegm accumulation in the upper body and heat damaging body fluids. On the other hand, if it is yellow coating, and the yellow coating is thin and slick, this would be exogenous heat in the interior or damage of body fluids by heat, also indigestion. Clinical significance: a disease evil just entering interior, body fluids not yet impaired by heat. If the coating is a thin yellow dry coating, then this is strong heat depleting body fluids. If it is yellow coating, greasy and wet, then this is heat dampness in the interior. If the coating is thick and yellow and dry, this would have high fever consuming body fluids. If the coating is blackish yellow, dry with patches, then this would mean strong heat exhausting body fluids. If the color of the tongue is gray, the coating is gray and dry, there is severe heat or dampness, cold, prolonged illness of digestive tract, dehydration or acidosis, which would mean he's a smoker. So clinical significance: high fever consuming body fluids, excessive fire due to yin deficiency, injuring the interior. If the coating is gray and wet, then there's phlegm accumulation in interior or cold dampness in interior. If the coating is black and dry, or black and dry with fissuring and prominent filaments, this is often critical stage of strong heat or cold in the interior, also upward flaming of heart fire. In center of tongue, this would be dry constipation or impending exhaustion of stomach qi. If it is in the root of the tongue, then there is strong heat in the lower jiao. Clinical significance: strong fire exhausting body fluids, impending exhaustion of kidney yin. This is a severe sign. If it is black and wet, then there's an upward flow of dampness due to yang deficiency and a strong cold. Thank you for your attention.
Let us now go to pulse taking. The topic is floating pulse. The normal pulse has the following profile. It is equally palpable at all three positions. Its pulsation comes and goes evenly and is moderate in force, and it has a regular rhythm and an even rate of 60 to 90 per minute. The pulse profile may vary in response to external and internal influences on the body. For example, in a baby, the normal pulse has a faster rate than that of an adult, and in a woman, it has a slightly faster rate than that of a man. In summer, because of the higher ambient temperature, the blood vessels dilate and blood flows faster, so that the pulsation comes more vigorously and goes gently. In winter, because the ambient temperature is lower, the vessels constrict and the pulse is deeper. In a thin person, the pulse is more superficial, whereas in a fat person, the pulse is deeper. A pulse may be abnormal because of its depth, rate, rhythm, volume, or force. The context of pulses of abnormal location refers to the depth at which the pulse is palpable and the length of radial artery over which it is palpable. The profile of a normal pulse is that it is palpable at all three positions of Guan, Chun, and Qi, and at the depth that is neither superficial nor deep. The floating pulse is palpable at a superficial depth, requiring only light touching. With increased pressure, the pulse shows a diminution in the force of its pulsation, but there is not an empty field. The ancients used the metaphor of wood floating on water. The clinical significance of a floating pulse indicates an illness in the exterior and is mostly seen in the initial stages of an exogenous illness. A floating but forceless pulse indicates an illness of deficiency in the exterior, mainly a contagious febrile illness with much sweating or attack by exogenous evil and physical condition of yang deficiency. A floating but forceful pulse indicates an illness of strength in the exterior, mainly a contagious febrile illness without sweating. A rapid floating pulse suggests an exogenous heat illness in the exterior, while a tight floating pulse suggests an exogenous cold illness in the exterior. A floating pulse is also seen in a patient weakened by chronic illness so that yang qi floats to the exterior of the body, in such a case that the pulse is characteristically floating and forceless. In addition, the pulse may become floating in a patient taking certain drugs to dilate the airways. In this case, the floating characteristic is transient. The principal factor in the formation of a floating pulse is exogenous evil qi. When evil qi attacks, nutritive yang resists it and excites meridian qi in the exterior, hence the floating pulse. If genuine qi is deficient and weakened yang qi floats to the exterior, the pulse may also become floating. In that case, it is forceless. A floating pulse could be feeble, forceful, rapid, or tense. The characteristic of a floating and feeble pulse is just below the surface that is felt with light touch and becomes faint on pressing but does not feel hollow. The analysis is defensive yang expels evil qi and keeps meridian qi in exterior. Deficient genuine qi allows weak yang to float, producing floating and feeble pulse. The clinical significance is deficiency illness in exterior with fever and sweating, or exogenous illness and physical condition of yang deficiency. For floating and forceful pulse, the clinical significance is strength illness in exterior with fever and little sweating. For floating and rapid pulse, the clinical significance is exogenous heat illnesses in exterior. And for floating intense pulse, the clinical significance is endogenous cold illnesses in exterior. Thank you so much for your attention.